Thank you, Sherry, and I'll try to do justice to Dick's talk. Interestingly, he and I put our talks together separately. He was going to cover epidemiology. I was going to do some of the clinical aspects, but as you'll see, there's some overlap, but we come at it from different perspectives. Dick has been an epidemiologist. Our paths have crossed over many years, and one of the first places he did work on asbestos was at a particular plant in Tyler, Texas, which probably about 25 years later I ended up doing some work at, though I had started doing some work back on the East Coast a bit earlier. So we'll try to give Dick the justice he is due. I apologize for any failings in presenting his material. So we're going to talk about asbestos epidemiology. And the history of this, for those of you that think that asbestos and asbestos-related disease is a new problem, it really isn't. At the Charing Cross Hospital in London, back in the turn of the century, that's 2 centuries ago, Dr. Montague Murray reported on a fatal case of lung disease, which didn't have a name at that time yet, of a 33-year-old male textile worker who died about 1900. He didn't report this until 1906. You'll see a quote from his paper that I'll have in my presentation. And the point about this was that Dr. Murray made note of the fact that this was the 10th and last of a group of 10 young men that had gone to work in an asbestos factory where they did the carding of asbestos. And he reported that his 10 mates or his 9 mates had predeceased him all of chronic lung disease. The first radiologic description of asbestos-induced lung disease was done by Pancoast and Pendergast. They reported this in the American Journal of Röntgenology and Radium Therapy in 1918, the same year that insurance companies in the United States and Canada decided they would not insure asbestos workers due to unhealthy conditions in the industry. So by 1918, it was very much appreciated that working with asbestos was not good for you. And if anybody knows about this kind of stuff, it's the insurance industry. The term asbestosis was coined by Dr. Cook, who's a British physician. He coined the term in 1924. He was involved in the case of Nellie Kershaw, who had, at the age of 12, not so unusual in those days, had started working in a cotton mill, and then at the age of 13 had gone to work at an asbestos mill, and at the age of 26 worked at the Turner Brothers asbestos facility, and she died of asbestosis at the age of 33. She also made it into the literature. The epidemiology continued to be gathered over time. Dr. Merriweather in 1930, and again you'll see a comment that I had in my presentation, did some of the first epidemiological work of asbestos workers, and he conducted a study in the asbestos textile industry where we reported on pulmonary fibrosis. What was interesting about the paper that he wrote with an industrial hygienist, a Mr. Price, was that not only did they report on the asbestos textile industry, but they made several other points. Males got disease, females got disease. It occurred in the textile industry, it occurred in the brake-making industry. It was a hazard no matter what the industry, no matter what your gender. This, while reported in England, did make it across the water. And there were reports in 1948 of excess lung cancer in both men and women who were registered and noted to have asbestosis. The first designation of asbestos as a lung carcinogen was in 1942. Wilhelm Uper wrote in a textbook that came out in that year on occupational cancers that he considered asbestos a carcinogen for the lung. Fast forward a few more years, 1955, the first epidemiological study, in fact, of lung cancer UPRA decided that it was a carcinogen without epidemiological studies. So Richard Dahl reported from a cohort of 113 asbestos textile workers who had been employed more than 20 years. There were 11 lung cancer deaths, less than one had been expected. So again, the epidemiology told us, and this was the first good epidemiology, that asbestos was in fact a carcinogen for the lung. Studies for the relative risk of developing lung cancer have varied anywhere from 1 to over 17, with the average relative risk working with asbestos being somewhere close to 10. Dr. J.C. Wagner was a pathologist working in South Africa. In 1960, he reported on 33 cases of mesothelioma between the years 1956 and 1960. To put this in perspective, mesothelioma was an extraordinarily rare disease. The hospital I trained at in New York, where there's an old history of studying mesotheliomas, there were roughly one case seen every 10 years out of 100,000 hospital admissions. Relatively, about 1 in a million persons would show up with a mesothelioma. He reported here on 33 cases in 4 years. They all occurred in the northwest portion of the Cape Province, where they had crucidolite mines. So now we had mesothelioma, which we now know is a sentinel tumor related to asbestos. In this country, Dr. Tom Mancuso did some of the first epidemiological work to identify mesotheliomas. He looked at mesotheliomas and lung cancers and asbestosis in a facility in Ohio. As you see there, death certificates identified 19 lung cancers, 28 asbestotics, and 7 mesotheliomas, with other cases to be found. This was from a particular factory in Ohio. He subsequently went on to report on 43 cases of mesothelioma in the railroad industry from one roundhouse in Pennsylvania. The physician that I trained with, Dr. Irving Selikoff at Mount Sinai, started doing work outside the manufacturing arena and looked at end product users. His claim to fame was studying 17,800 asbestos insulation workers, and he concluded that end product users were at the risk of developing asbestosis, lung cancer, mesothelioma, GI tract cancers, and others that we'll talk about. You notice the salamander down there. That was the International Association of Heat and Frost Insulation and Allied Workers group that he studied, and that cohort of 17,800 is still being followed today. With the coming of OSHA in 1970, Selikoff and others lobbied Congress about the hazards of asbestos and about creating this agency. And one of the first standards promulgated was, in fact, the standard for asbestos, and it started at 5 fibers per cubic centimeter, which was to automatically drop to 2 fibers per cubic centimeter shortly thereafter. The other interesting thing, if you know the relationship, of course, between NIOSH and OSHA, NIOSH makes recommendations. OSHA is the enforcement and regulatory agency, but they recommended the control of asbestos. But as you notice there in the highlighted portion, when it came to controlling workplace hazards, they were really dealing with asbestosis, and they said that only a ban could assure protection against the carcinogenic effects of asbestos. So this was a document put out by NIOSH back in the 1970s, which was in a sense calling at that time for the first ban on asbestos. If one fast forwards to now, and we're looking again at the epidemiology, the World Health Organization has estimated that there are about 90,000 deaths per year from occupational exposures to asbestos, roughly 43,000 mesotheliomas, 39,000 lung cancers, and 7,000 deaths worldwide from asbestosis. We'll comment on other matters as well. Now, is this disease really a pandemic? Well, the definition of a pandemic, as put forth by an epidemiologist, is the excessive occurrence of a disease in a large portion of the world. The H1N1 pandemic, which is what it was called by the World Health Organization last year, resulted in 14,000 deaths. That was considered a pandemic. the fact that we have 90,000 asbestos deaths every year, I think should also be considered as a pandemic. And as Dr. Lemon notes in the footnote there, the 90,000 is undoubtedly an underestimate. It does not include other cancers such as cancers of the larynx, ovary, and some others that we'll talk about later. Asbestosis deaths, as data collection gets better, have been shown to increase over time. And here's the worldwide data for mesotheliomas, and as you see, with some variation for a fairly uncommon disease, it's been going upwards. In Canada, it's been going upwards. And deaths from asbestos disease, as you see there on the right in the top right corner, has also been going up around the world. The pattern, however, is changing. Where the disease occurs has changed. The Europeans, for example, who banned asbestos as far back as 30 years ago, are now seeing a decrease over time in asbestos-related deaths, where other parts of the world, like Asia, where they continue to increasingly use asbestos, that is not the case. World production has been unfortunately fairly steady over time. The peak in the United States was in 1972 in terms of importation and use, but as you see, 1960 the world uses about a little over 2 million tons, and in 2007, the last year we have data for, the world still used about 2 million tons. Again, where it has been used has been shifted. And here gives you that data, whereas if you go and look at what was used in Europe in 1960, by 2000 it was markedly reduced. Same thing in North America. In this country, we only import about 10,000 tons a year versus about 775,000 tons in 1972. As perhaps Dr. Castleman will comment, what it doesn't look at is imported finished products that contain asbestos. Unfortunately, if you look at the data from Asia, you see it was fairly modest in 1960 and increasing, and overall the worldwide use is still quite considerable. Again, as an epidemiologist, how do you stop an epidemic? And the great John Snow removed the pump handle to stop the source contaminated water back in London. And the way you stop an epidemic in other ways is to have global eradication. It's been done for smallpox. You vaccinate people. There's the history, as you see there, of the eradication of smallpox starting in 1796 with the invention of a vaccine. And by 1979, the world announced the global eradication of smallpox. Can that principle be used for something like asbestos? Well, we think so. Its legacy will continue unless we put the brakes, that is asbestos-free brakes, on the use of asbestos. So putting the brakes on asbestos-related disease follows as you'll see here. Ban asbestos. Recognize remaining sources of asbestos. Access asbestos release from these sources. Keep records of these sources, and eliminate remaining sources where asbestos can be released. And lastly, survey patterns of asbestos-related disease. It's what was done with other materials that caused epidemics, and you can, in fact, apply that to something like this. So the question is, are you doing all you can with regard to getting asbestos eliminated from our society and ultimately from the whole world? And that is the message that Dr. Lemon wanted to bring you. I had been asked to come along with Dick and to talk about the clinical aspects of asbestos, and some of that you've already heard. So I'm here to talk about the clinical aspects of asbestos disease. I come to you, as you heard earlier, from Drexel University. And again, for those of you that may not know, I'm sure many of you here do, but asbestos is a group of naturally occurring fibers that cause a range of human diseases. It's not something made by man. It's extracted out of the ground, processed, and the important point is that all fiber types are responsible for the production of disease. It's not just the 5 amphiboles, it is also the serpentine form that we call the white asbestos or chrysotile. If you don't go away with anything else, just remember that chrysotile asbestos, no matter what the Canadians want to tell you, is not the safe asbestos. You can't sprinkle it on your breakfast cereal and eat it with impunity. You heard from Dr. Lemon's slides about the case of the gentleman who died around 1900, and this is actually a piece of tissue taken at his autopsy by Dr. Montague Murray. And you'll see in the right upper corner there is a somewhat clear asbestos body. This was actually found. He didn't know what to call it at the time. He called it a curious body. But this is from the autopsy of that 33-year-old gentleman, so clearly asbestos was found in the tissue. And when Dr. Montague Murray wrote this case up, and this was 1906, one hears, generally speaking, that considerable trouble is now taken to prevent the inhalation of dust, and so the disease is not so likely to occur as heretofore. 1906. He didn't exactly get it right, did he? So what is the spectrum of asbestos-related disease? Well, I'm a simple kind of guy. I try to think about things in simple ways, and I figure there's the non-malignant diseases and the cancers. The non-malignant diseases are asbestos warts. It can get under your skin. Minor problem. You don't see it very often, but it needs to be mentioned. Benign asbestotic pleural effusions. The first disease to show up within 10 years of exposure to asbestos in most cases is a benign asbestotic effusion. It's benign because there's no cancer, scares the heck out of the clinician because it's a bloody effusion. You're looking for the cancer, you don't find it. And then you have parenchymal and pleural asbestosis. For those of you that don't understand the term pleural asbestosis, and think of things as pleural plaques or pleural thickening, pleural disease. That was a reinvention of science done back in the 1960s when lawsuits came into being. The original description of pneumoconiosis, or dust diseases of the lungs, goes back to 1867 to a German pathologist by the name of Zenker, who said that the dust diseases of the lung involve the lung and the pleura. And if you read the textbooks of the 1930s, the book on silicosis and asbestosis that was common in that era, also talks about the pleural aspects of asbestosis. And it was with the reinvention of a particular pathologist who was helping out the asbestos industry, I suspect, in having pleural disease not classified as asbestosis, so it could be called at the time a beauty mark or a indicator of exposure, got us away from thinking about it as pleural asbestosis. But if you read Selikoff's text from 1976, that's a term that he uses. The thing about asbestos, there are a lot of occupational carcinogens, obviously, but this is one that causes a wide range of cancers. Lung cancer, mesothelioma of the pleura, the peritoneum, the pericardial, and other sites. GI tract cancers are found in excess, esophagus, stomach, colon, and rectal cancers. Laryngeal cancer, oropharyngeal cancers, and in excess of kidney cancer. So it's a wide spectrum of disease, and not all of those are considered sometimes in the data that we look at. We need to remember that these diseases are often misdiagnosed and or underreported. Dr. Selikoff, working with Dr. Suzuki, a pathologist that he had at the Environmental Sciences Laboratory, showed that many cases of mesothelioma were misreported as lung cancers or carcinomatosis. And were not recognized for what they are. What is interesting, things have changed. There are now much better histologic materials available that even the community pathologist in a small hospital today can get a pretty accurate diagnosis of most mesotheliomas. But even sometimes that is difficult, and that's why we still have things like the U.S.-Canadian mesothelioma panel that will look at difficult cases, or sometimes cases are sent to the Armed Forces Institute of Pathology, one of the largest collections of mesotheliomas being housed there because of young naval officers who started in the engine rooms of ships and got their mesotheliomas when they were captains and admirals. The symptoms are often nonspecific. shortness of breath, pain in the chest, cough, abdominal pain. It's a condition that is not always clearly appreciated. There are lots of things that can do this, and so it's often very late in the diagnosis or very late in the case till a proper diagnosis is made. As I mentioned already, Meriwether and Price talked about their work in 1930, but in that paper where they talked about who got disease, they also talked about another very important principle, which isn't always thought of, which is you need to educate workers. We don't do that enough. This is 1930, you need to educate workers about hazardous materials so they can protect themselves. They talked about better ventilation, and they talked about if you can't put enough ventilation in, you need to put workers in respirators. This was 1930. There's the concept of duration of exposure versus duration from onset of exposure. How long do you have to be exposed to asbestos to get disease is one issue, and then when does the disease show up? So let's clarify that. First, let's look at the data on which types of asbestos cause disease, and this is work of Dr. Wagner, who went to his grave claiming that chrysotile didn't cause mesothelioma. But as you see here, you got as many lung cancers with Canadian chrysotile as you did with crucidolite, and you got just as many mesotheliomas in his own work. How much does it take? That same study with animals showed that literally 1 day of exposure would give rise to both lung cancers and mesotheliomas. And while it's not common in the human condition, there are published data. Morris Greenberg, for example, from Great Britain, published in The Lancet in 1985, of a man who cut some asbestos boards in his backyard one day to build a shed, built the shed, thought nothing more of it, and 30 years later developed his mesothelioma. So there are these case reports, and certainly very short periods of exposure. I mentioned the Tyler plant. The earlier iteration of that had been a plant in Paterson, New Jersey, and Dr. Solikoff showed that with 1 month or less, 1 month or less of exposure, there was a doubling of the risk of developing lung cancer working in that factory. So you don't need much. The duration of exposure was short. On the other hand, when does the disease show up? As you see from these curves, disease begins to appear at about 10 years. The peak here for lung cancer is out at about 30 years. Mesotheliomas and asbestosis deaths are out a bit further. It seems like a long time, but remember these were workers who, when they were 16 or 18, went to work in the Insulators Union. 40 years later, you're still quite young developing these diseases. Where are the significant risk occupations? Asbestos mining and milling, manufacturing, construction, shipbuilding and ship repair, power facilities, railroads, and there are other exposures, and we'll hear some about that. Household contacts, consumer products, demolition and waste, disposal, sprayed surfaces, and public buildings. Let's try to bring that to life a little bit. Anybody recognize that building? That's the World Trade Center being built. And here's an asbestos insulator spraying asbestos on a steel beam at that facility. 40 floors of one tower were sprayed with asbestos. In 1972, the ban came in on the spraying of asbestos. The rest of that tower and the other tower were sprayed with other materials. So here he is spraying asbestos on a steel beam, and as you see, some of it even stayed on the beam. What happened to the rest of it? This is what the laborer would come by and sweep up. This is what the electrician was exposed to. This is what the brick mason was exposed to. So it isn't just the 1% of construction workers who directly handle asbestos, but virtually all construction workers at this period of time were significantly exposed to asbestos. Then we have this. No matter what the automobile industry and the brake manufacturers want to tell you, there is plenty of disease that comes from brake dust. Here's something that about 1 million workers in this country do, is work on brakes. If If you ever come to visit me in my office, you'll see this sitting up on my shelf. It was a gift to me of a gentleman who no longer had need of his leak-proof asbestos liquid roof coating. And I could show you many, many more products, but the point is that there were between 3,000 and 4,000 products made with asbestos in its day. And yet here we are without a ban in this country, with 50 countries in the world with a ban. Their cars stop, they don't have more fires, you know, things work just fine. Here was something that was really sort of one of the more bizarre things, a coat made of processed wool that had 20% asbestos in it. At least we knew enough to put our lab tech in a proper respirator as we brushed it to see how much asbestos was liberated. School children were subjected to making the asbestos head with leftover papier-mâché materials from asbestos processing that was recycled into materials for use by school children. And here I am, a physician, and I used to and still prescribe medications for patients. And until it was banned by the FDA, asbestos was used as a filtering agent, and we would be injecting asbestos fibers into our patients every time we gave them Valium, penicillin, streptomycin, or whatever, because it ended up in the vials along with the drug that we were trying to put into people. To finish up, none of us will really forget that day. We saw the World Trade Center going up. Here's a picture of it coming down. This is what Lower Manhattan looked like with 4% asbestos in some of the dust. It varied, but it was up as high as 4%. The biggest problem, of course, has turned out to be the concrete material with a very high pH. You notice the steel beam there with, I don't know if this is an asbestos-coated beam or not, but this is the kind of exposures that workers had. Anybody know what happened to all that steel? I mean, a few steel beams ended up in the new ship that just got launched this year, the USS New York, but a lot of it was recycled over to India and to China, shipped over with the asbestos on it that the workers over there could take off before we sent it over to them. So the legacies of the past, if we stopped using it today, we'd still have projected disease and death for the next 30, 40, 50 years. We still continue to use it. Engineering controls are not well developed. In this country, we talk about regulatory feasibility. The Canadians talk about the safe use of asbestos. We still have legal uncharted complexities. Over 80 companies have gone bankrupt. And we need to remember that there are 25 million tons of asbestos in over 700,000 buildings in this country put in place. So even if we stop putting any more in, we have to worry about how we deal with it and taking it out. So we need to educate physicians, workers, and others, and to use asbestos substitutes. And with that, I'll finish my comments.